We're into the final stretch of this initial session, and so next we're going to have a presentation on the analysis of resident and faculty assessment methods across radiation oncology, which is going to be presented by Rajashri Manjunath. Thank you so much.
Thank you. Hello, everyone. My name is Rajashri Manjunath. I am a first-year medical student at the AUG Medical Partnership in Athens, Georgia. Today, I'm representing our research on the analysis of resident and faculty assessment methods across radiation oncology. I'm not able to advance. Oh, there we go. So this is an outline of the presentation I'll be giving today. I will start with a discussion of the background and purpose of the study, then guide you guys through the methods, and finally discuss the results and their significance. So the American Council on Graduate Medical Education provides 6 core competencies that can be used to evaluate residents. These are practice-based learning and improvement, patient care, systems-based practice, medical knowledge, interpersonal skills, interpersonal communication skills, and professionalism. I will take a moment here to define a few of these competencies. So practice-based learning and improvement focuses on a resident's ability to evaluate the care they provide and find opportunities within their practice to incorporate evidence-based medicine. Systems-based practice focuses on a resident's ability to function as a member of a multidisciplinary healthcare team in an effort to provide high-quality and cost-effective care to patients. So radiation oncology programs across the United States have incorporated these six competencies to varying degrees. And while that might be a reflection of the diverse climates across these institutions, it can lead to a lack of consensus within the field. Similarly, the faculty evaluations also vary in terms of the length and content. This can further promote that lack of consensus. So why do we need to learn about how we evaluate radiation oncology residents and faculty members? There's data from other specialties that indicates we need to take a closer look at about how we perform these evaluations. Less than half of the internal medicine residents believe that their evaluations were extremely or very useful in informing them of their progress. 77% of orthopedic surgery residents in a study felt that the 6 core competencies were not sufficient to assess their surgical skills. 84% of internal medicine residents believe that their peers could provide more valuable feedback. We also need to think about how we evaluate faculty members, because by providing faculty members with appropriate feedback, we can help them foster a more effective and helpful learning environment for budding physicians. So this brings us to the purpose of the study. In this study, we will analyze the variability in resident and faculty evaluations across radiation oncology programs, determine which criteria are more or less represented in resident evaluations, and will define which factors are most used in faculty evaluations. Go back. I have to. It keeps advancing. There we go. Okay, one more slide, please. I can't control it for some reason. Slide forward, please. Thank you so much. So to achieve this purpose, we collected faculty and resident evaluation. Faculty resident evaluations are going to be abbreviated as FRE, and resident faculty evaluations are going to be abbreviated as RFE forms from different radiation oncology programs, primarily located along the Eastern Coast and in the Midwest. So we categorized the FRE or resident evaluation questions based on the ACGME core competency that they assessed. The faculty questions were classified into the following categories: teaching skills, patient care, personal qualities, the result of the rotation, knowledge, mentoring skills, learning climate, research, and communication. Finally, we used ANOVA to analyze the frequency of questions within each category and determine if there was any significant difference between institutions or between categories. So what did we find from our analysis? Our analysis of the resident evaluation or FRE questions showed that professionalism and patient care were the most represented competencies, while systems-based practice and practice-based learning and improvement were the least represented competencies. There was a significant difference between institutions in terms of the total number of questions they had on their evaluations, ranging from 8 questions to 28 questions, but there was no significant difference across institutions regarding the number of questions within each category. Our evaluation of faculty forms showed there was variability in terms of length, formatting, and content of the evaluations. Most of the questions focused on teaching and personal skills and personal qualities, sorry. So what do our results indicate? If anything, they indicate that we need to take a closer look at how we evaluate the least represented competencies, which were systems-based practice and practice-based learning and improvement. Systems-based practice is a difficult competency to assess in medicine just because its scope is not well defined. And this might be particularly difficult in radiation oncology, but it's a very important competency to assess nevertheless, because cancer care requires a multidisciplinary approach. So in the future, we can study the outcomes of assessing or not assessing this competency and see if it makes a difference in terms of patient outcomes. There's also an opportunity for us to use evaluations from ancillary staff who might be able to provide more valuable insight than faculty members regarding a resident's capabilities with respect to the systems-based practice competency. So practice-based learning and improvement is also a very important competency because it assesses a resident's ability to evaluate their care and to dedicate themselves to a career of lifelong learning. And this is particularly important during residency, but also in their careers beyond. So there are some limitations to our results, particularly because we collected evaluations from 12 institutions, primarily located in the Midwest and Eastern United States. If we were to incorporate other radiation oncology programs, our results might vary. So where do we hope to take this project in the future? In the future, we hope to correlate these project findings with resident perceptions regarding their evaluations and understand if the criteria used to evaluate residents right now is sufficient for their needs as learners. And hopefully we can use this information to facilitate positive change. We will also assess a value of incorporating evaluations from non-faculty members, such as peers, nurses, and radiation physicists, and use these findings to develop consensus regarding evaluations for both faculty and residents. At this time, I'd like to acknowledge all the other contributors to this paper and thank all the programs that have contributed their surveys to our study. Thank you all so much.
All right, thank you. I always love seeing projects or focuses of research taking in places that I wouldn't have thought of. Everyone always focuses on like resident feedback and review, but also incorporating the feedback for attendings is also very important. So, because everyone is supposed to learn from the process. So, great presentation. You know, I think you noted how much the feedback to attendings is very much so just on teaching and personal qualities, while the resident feedback is based on that 6 competencies. And I think it's because we've provided programs a structure or a format to work off of, and we haven't really provided them for the reverse. So I think your work will fill that space. Do you think that programs are mostly developing their feedback or surveys for residents to attendings based on just like making sure the day-to-days are okay, or do you think there's like a greater overall departmental goal that they're trying to address? And do you think that's a problem one way or the other?
I think if I understood your question correctly, I think the systems-based practice, that the fact that that competency is less evaluated shows that they're more concerned about the day-to-day progress of residents and not necessarily about how they can incorporate feedback from other fields that they're working with. So I think there is a point to be made there in terms of how we can assess their competency to provide care continuing forward and how they can evaluate the care they provide rather than just focusing on what's happening on an everyday basis.
That's good. It's a good point. You know, should these assessments be only making sure that the day-to-days are going okay and crossing T's, dotting I's, or should the greater goals of the department for the residents and the staff be addressed in their surveys? So I appreciate that. Did they comment on the timing of these feedbacks that they generally receive them? Were they like right at the end of the rotation, the end of the year? Any sense of that?
I apologize for the disturbance. I have construction going on, but yes, actually, we didn't see that here in the survey that we sent out or the surveys that we received. But I have seen in other surveys, in other studies that were looking at these evaluations, that was a concern, especially in orthopedic surgery rotations. Students were concerned about the timing of the feedback and how effective that was in terms of informing them of their progress within their rotation.
And then one more question that's from the field. Any thoughts on how to keep people open to feedback?
I'm not really too sure about that. I think that we could start with helping residents be more confident in telling us of regarding how they feel about these evaluations, and see if we can assess their attitudes and their beliefs regarding these evaluations. Hopefully, then they would provide us with more feedback regarding what helps and what doesn't help.
Yes. Apparently it was more focused on the faculty being open, but I think, as long as there's a top-down drive in a department, that kind of openness will happen. It can't necessarily happen from the bottom up, unfortunately. All right, so thank you so much for your presentation.